Hello everyone, I'm Dr. Divya D'Sa and welcome back to AceAnatomy, where anatomy becomes simple, visual and unforgettable. In today's video, we are diving deep into the anatomy of radial nerve, the largest terminal branch of the posterior cord of brachial plexus and the principal nerve of the extensor compartment of the upper limb. We will explore its origin, course, relations, branches and areas of supply. So if you are ready to ace your anatomy, let's get started. Let's look at the important features of radial nerve. So radial nerve is the largest nerve of the upper limb. It's the largest branch of brachial plexus. It's a continuation of the posterior cord of brachial plexus and its root value is C5, C6, C7, C8 and T1. So it carries fibers from all the roots of brachial plexus, but T1 fibers are not constant. The course of the radial nerve runs the entire length of the upper limb from its origin in the axilla to the termination of its branches in the hand. Now let's look at the course of the radial nerve in the axilla. In the axilla, the radial nerve lies posterior to the third part of the axillary artery and anterior to the muscles forming the posterior wall of the axilla. In the axilla, it gives three branches. The posterior cutaneous nerve of arm, which provides sensory innervation to the skin on the back of the arm up to the elbow, and two muscular branches, that is to the long head of triceps and now to medial head of triceps. The radial nerve enters the posterior compartment of the arm at the lower border of teres major muscle. It enters the lower triangular space through which it reaches the spiral groove along with the profunda brachii artery. The course in the radial groove is clinically very important. It is the landmark you must never forget. Here the radial nerve lies in direct contact with the humerus. It winds around the back of the humerus in the spiral groove, traveling with the profunda brachii artery sandwiched between the medial and lateral head of triceps. So it is the single most clinically important part of its course. So here at the lower end of the spiral groove, the radial nerve will pierce the lateral intramuscular septum of the arm, that is about 5 cm above the lateral epicondyle. It will pierce the intramuscular septum, that is the lateral intramuscular septa, and enters the anterior compartment of the arm. The radial nerve in the spiral groove gives 5 branches, 2 cutaneous and 3 muscular. And in the anterior compartment of the arm, it will give 3 branches, that is 3 muscular branches. Now let's see what are the branches given by the radial nerve in the arm. The muscular branches of the radial nerve in the spiral groove include nerve to lateral head of triceps, nerve to medial head of triceps, and nerve to anconeus. Then it pierces, once it comes out of the spiral groove, it pierces the lateral intramuscular septa and enters the anterior compartment of the arm, where it supplies one of the flexor muscles of the arm, that is brachialis muscle. So brachialis muscle is known as the hybrid muscle because in addition to its nerve supply from the musculocutaneous nerve, which is the nerve of the flexor compartment, it also receives nerve supply from the radial nerve. Then the other 2 extensor muscles which are supplied include the brachioradialis muscle and the extensor carpi radialis longus muscle. The cutaneous branches of the radial nerve in the arm include the posterior cutaneous nerve of arm, which supplies the skin over the posterior aspect of the arm. Then we have the lower lateral cutaneous nerve of arm, which supplies the skin over the lower lateral part of the arm. And it also gives the posterior cutaneous nerve of forearm, which supplies the skin over the posterior aspect of the forearm. The radial nerve then enters the cubital fossa by passing between the brachialis and the brachioradialis, and then between the brachialis and the extensor carpi radialis longus. And once it enters the cubital fossa at the level of the lateral epicondyle of humerus, it terminates by dividing into a superficial branch and a deep branch in the lateral part of the cubital fossa. So this division here in the cubital fossa is important because this is also a common site of radial nerve injury. Thus, the radial nerve has two terminal branches, the superficial radial nerve, which is purely sensory and supplies the dorsum of the hand and the lateral 3.5 fingers up to the nail bed, and the deep branch, which is also called as the posterior interosseous nerve, which is purely motor and dives into and through the supinator muscle and supplies essentially the entire extensor compartment of the forearm. In the forearm, the radial nerve supplies the extensor compartment of the forearm through its deep terminal branch, which is otherwise known as the posterior interosseous nerve. And through its superficial terminal branch, it supplies the skin of the lateral side of the dorsum of the hand as well as the lateral 3.5 digits except for the nail beds. So let's study each of these nerves, the branches, individually. The superficial branch, also called as the superficial radial nerve, is sensory and it runs downwards over the supinator and the pronator teres and flexor digitorum superficialis deep to the brachioradialis muscle. About 1/3 of the way down the forearm, that is at about 7 cm above the wrist, the superficial branch of radial nerve passes posteriorly, emerging from under the tendon of brachioradialis proximal to the styloid process of radius, and it then passes over the tendons of anatomical snuff box where it terminates as cutaneous branches. In the hand, it provides sensory innervation to skin over the lateral part of the dorsum of the hand and dorsal surface of the lateral 3.5 digits proximal to the nail beds. It also supplies a small area over the lateral aspect of the palm. Now let's study the course and branches of posterior interosseous nerve, which is the deep branch of radial nerve. The deep branch, also called posterior interosseous nerve in the cubital fossa, supplies two muscles. One is the extensor carpi radialis brevis and the supinator muscle. After supplying these two muscles, it passes through the substance of the supinator and enters the posterior compartment of the forearm. Posterior interosseous nerve supplies all the extensor muscles of the forearm except for brachioradialis and extensor carpi radialis longus. Posterior interosseous nerve in the extensor compartment of the forearm supplies extensor carpi radialis brevis, extensor carpi ulnaris, extensor digiti minimi, extensor digitorum, abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus. And to summarize the radial nerve, the root value of the radial nerve is C5, C6, C7, C8 and T1. It is the continuation of the posterior cord of brachial plexus. And to talk about its course briefly, in the axilla, it lies posterior to the axillary artery and it enters the posterior compartment of the arm by passing through the lower triangular space. In the arm, it runs in the radial groove or the spiral groove, and as it leaves the spiral groove, it pierces the lateral intramuscular septa and enters the anterior compartment of arm. And in the cubital fossa, at the level of the lateral epicondyle of humerus, it divides into its terminal branches, a deep and a superficial branch. The deep branch is also called as the posterior interosseous nerve, which is motor in function. And the superficial branch or the superficial radial nerve, as it is called, is the sensory branch. In the next video, I will be discussing about the clinical correlation of radial nerve. And that's a wrap for today's episode of Decode Anatomy on Radial Nerve. Thank you for watching AceAnatomy. Remember, Don't just memorize anatomy, understand it, visualize it, and you'll never forget it. If you found this video helpful, don't forget to give it a thumbs up and share with your friends. Hit the subscribe to stay connected with AceAnatomy and ring the bell so you're the first one to know when we decode another fascinating topic. I'm Dr. Divya D'Sa, and until next time, keep learning, keep growing, and keep acing your anatomy.